Good morning, everybody. I'm Eli Beckman. I'm the mayor. We've also got Town Manager Todd Cusimano, Assistant Town Manager and Town Clerk Rebecca Vaughn, Public Works Director RJ Suko, Planning and Building Director Adam Wolf, and the Fire Marshal and Acting Fire Chief Ruben Martin on the call here. We just wanted to open with kind of a quick update for you guys, especially around coronavirus. So, just want to make sure that everybody understands that things are getting worse. They're not getting better. Even though we're continuing to slowly reopen, the coronavirus situation, especially in Marin County, is really not going in the right direction, unfortunately. So it is of critical importance that everybody wear their mask when you are in public, including if you're outside, if you can't maintain distance of more than 6 feet from people. That is critical. I mean, we're seeing cases spike in Marin County. Marin's been added to the governor's watch list, which means basically, we're on notice now that if our numbers don't go in the right direction, and they're not since we've been added to the watch list, that Gavin Newsom is going to start closing things down again. And I don't think any of us want to go through a second shutdown. I think that'd be really damaging, not just to our summers, but also to the local economy and to, all of us who are local business owners. So it's just critical that we all be really diligent in maintaining social distance and wearing your masks. Indoor dining has already been reclosed in Marin County. I don't think that I personally ever saw anywhere that was offering indoor dining, but that's an example of something that had been reopened by the public health officer and then was closed back down by the state after our numbers kept increasing. So I'll turn over to Todd. I think he's got a little more detail for us on that, but I just really want to implore everybody to be super cautious these days because coronavirus is still out there. It's still spreading, even though things are reopening. All right, Todd.
Yeah, no, thanks, boss. So I got this from county, the Office of Emergency Services yesterday, just a quick update as of yesterday. And so in Marin County, we've had 1,483 confirmed cases. 1,036 of those cases have fully recovered. We've had 19 deaths in Marin County, and we currently have 34 hospitalizations due to COVID. And again, to date, the total amount of tests completed in Marin have been 34,100. And then, as the mayor said, we're on the watch list. And really, one of the key things that'll set us back and take us back to phase one, quite frankly, is the number of hospitalizations. So that's what they really look at. And so you have different ratings that they put us in. And right now we're in the moderate rating, but if it hits severe, you're going to look at us potentially rolling back pretty severely. And so what that is we have 250 beds. And so available for COVID. And if you go past that into the extreme phase, from moderate to extreme, we'll roll back. Right now we're at 193. 193 beds have been taken due to, are not available now. And so if we go over 250, that will be what the governor and our county health official look at for rolling back. And so I think at the county level, at the local level, we're looking for consistency in how we enforce that countywide, because hey, one city or town can do a good job, but if the one next to us isn't, then we're all susceptible. And so as the mayor said, we're going to start going to a pretty heavy enforcement. And so if you're not wearing your mask and you're not following what we're supposed to be doing, we're going to start enforcing it. Something just off to the side that I want to just throw out there that I'm concerned about as a manager, because policing is humanistic. And, when I ask our police officers, especially in the state that we're in the nation, to go ahead and take on quality of life issues, to take a heavy enforcement hand in dogs off leashes, on barking dogs, on noise complaint issues with leaf blowers, and then now citing people for not wearing a mask. I'm concerned about what that is going to do, in our small community. And so, but that's where we're at, right? All of our complaints right now are those four things. And so my direction, based on what I've heard and talking to the mayor, I'm going to ask Central Marin Police Authority to take I think we've educated, I'm going to have them take a full enforcement across the board in those areas. So leaf blowers, noise barking dog complaints, dogs off leash, and then not wearing your mask. We're going to take a heavy enforcement hand moving forward to see if we can help curb it. And we're going to ask our partners in the other cities and towns and county to do the same. And so with that, I'm happy to open it up, boss.
Thanks a lot, Todd. I have one quick question for you. I think it was maybe 2 weeks ago that we were learning about the outbreak at San Quentin, and I know that those numbers are not counted against Marin County's totals. But I was curious. I think there's a lot of concern in the community about whether or not those individuals are going to be hospitalized in Marin County, and whether that might take up beds in Marin County. And then I think it may have been you, or I forget if it was someone else that was telling us that it sounds like the state penitentiary has basically agreements with other hospitals outside of Marin County, that's where they would send the bulk of San Quentin patients if they needed hospitalization. Is that right, or could you speak to that at all?
Yeah, boss. I'm just pulling up a document right now. Let me see if I can get that.
In the
Yes,
meantime, I'll just tell everybody who's on the line, go ahead and throw your hand up if you have a question for us.
I can speak a little bit to the San Quentin thing, Todd, if you want.
sure.
Yeah, so early on, we've been working with Marin County Emergency Medical Services, our local EMS agency, and meeting regularly with San Quentin. We were meeting with them every Friday on a conference call, trying to see what their overall plan was. Once we started seeing a huge surge coming out of San Quentin, they were transporting literally 10 to 14 patients out of there daily. With some of them were coming to the Marin County hospital system. It was just inevitable.
Right.
They have since last week instituted incident management team. So Cal OES came in and basically are running it similar to multi-casualty incident, similar like multi-patients. And what they're doing is they also brought in a local private ambulance company. So 5 ambulances, so they wouldn't impact the local 911 system. And the goal is to try to transport most of these patients, if possible, that are non-critical to hospitals outside of the region or outside of the area. A lot of them went into San Francisco, into Oakland, San Mateo County. And looking at the last document, I believe there are 12, at least 16 patients that are been transported and admitted to the local hospital system. So some of the inmates are coming to our local system.
Sure. Okay. Thanks, Ruben. And of course, I think it's understandable that some would have to come here. We certainly wouldn't want to see, somebody needlessly die because they were denied, admittance to the closest hospital. I think there's just been concern about the volume, but that speaks to that. So thank you. And Todd, you were going to say something?
Yeah, and thanks, Ruben. Yeah, so it looks like right now there's 1,388 active cases. One of those happens to be my brother, who's a San Quentin guard, unfortunately. So our family gets to quarantine for a period of days. And as Ruben said, there are currently 67 patients that are hospitalized from San Quentin of that 1,388 number. 13 of them are in Marin, 7 are in the ICU. And so that's what we're looking at there. And then when I started this conversation, so the County of Marin healthcare system impact level, that's where the rubber meets the road for us. There are 4 categories: minimal, which is less than 50, low is 50 to 150, moderate is 150 to 250. That's where we are right now. Currently, we are at 193. And then severe is greater than 250. And so that's where we start to be impacted. And then something else that we're seeing as a trend, Southern California has been hit heavily, and we're starting to see some of the hospitalizations, they're starting to move some of the patients north into the Bay Area. So that's happening. And then they're also seeing, and as they've done it, especially in Marin, it follows that trend. And one of the reasons why we closed indoor dining is it's at the restaurant level. It's 40% increase in the restaurants. And so that's what we're seeing. And so that's why they're rolling that back. And the other one is, I think a lot of us have gotten laxed over the last few months, and you're seeing it at the family level. So there's birthday parties, people are starting, hey, we're going to do a social distancing party. Well, when you walk into the house, you don't have your mask on. When you go outside, to be 6 feet apart, right? Like you would in a restaurant. So that's where we're seeing it, and it's heavily impacting people, and so we just need to be smart about it and patient, or else we're going to roll backwards. So
yeah. Absolutely. And I think we've all seen that with our eyes. I've been walking down the street and I see people having like a little front yard party. And I get that it's safer when you're outside, but you'll still see people who are clearly not, or who I know are not in the same family sitting very close to each other, way less than 6 feet apart. We can't do that. I know it's tempting. I know it's summer. I know, we feel like things are opening back up, and it's easy to kind of tell ourselves that means it's safer, but it's not safer yet. Um, Todd, one more time, sorry, those numbers that you were giving for the different categories of risk, were those hospitalizations or like ICU patients, or what was that?
Those are actually hospitalizations. So those are
Okay.
beds available.
Okay.
Yeah.
Sounds good. Thank you. All right, we'll go ahead and turn it over to the public for questions now. Thank you guys for that really helpful update. Lucinda's got her hand up here, so we'll go ahead and get her on the line. Good morning, Lucinda.
Good morning. Just to follow up on a couple of questions with regard to CD19. What are the plans for additional beds if we go beyond the availability? And what happens with the inmates that we are covering as far as beds? How does that impact what's available for the community?
Yes, so Ruben can jump in too, but as I understand it, there's over 150 plus beds that San Quentin, they have a mini hospital too, and resources at the state level. And so they're actually, kind of taking care of their own, except in those high risk cases that I gave of like 7 are in ICU, but the majority of them are staying on site. And then for us at the Bay Area level, our 250 beds also include some of the hotels. We've partnered with hotels to open up rooms for someone that is not like high risk, like ICU, but is sick and needs to be quarantined for a period of time and needs medical assistance. And so we're using all resources available. And again, right now, we're okay, but again, as things spike, we have to be prepared for that. And that's something that Marin OES, is working on as we speak. Do we have the option for 100 additional beds? And what you would probably see is we would handle like a mass casualty incident. We would open tents. We would, partner again with more hotels to open up hotel rooms. We would do things with the hospital. So there is a plan. We won't be reactive. They're being very proactive in how we respond to that. But again, the best that we can do is to educate our communities and do our part, right? Let's do our part and make sure that it doesn't get to that point.
Thank you, Todd. Then also, with regard to the safety when an inmate is in the hospital, it's my understanding, based on when I had to make visits to ER, that there was always 2 officers assigned per prisoner. How does that work when the prisoner is admitted to the hospital? And what happens when those additional people go out into the public? Doesn't that spread the exposure? How is that handled? I mean, what do we do about that?
I think those are in the protocols within the hospital of where they go, how many people are impacted, taking certain wings and making it available specifically to COVID. But you're right, the guards are susceptible to this, and they're getting sick, but they work in 2. So if someone's admitted into the hospital, you will always have 2 guards 24/7 for each inmate. And so it does add, to the risk. Absolutely.
Okay. And then just another question that I had when you were talking about the enforcement for the 4 complaints that are coming in. What are some of the fines? If we could communicate that to people, maybe they would understand this is getting serious, and when it hits their pocketbook, take preventative action as opposed to be this stick it in your face, I'm not going to wear a mask type of thing.
Yeah, it's a good question, Lisa. I would have to, off the top of my head, most fines start because there's added fines to it once you go through the system in the $100 range, and a lot of them start to double and increase as you become a habitual violator. So like barking dogs can start in the $100 to $200 range, and they can quickly get up to $500 to $1,000 if it continues. The dogs off leash are usually like a $75 to $80 ticket. But I think you're right. It's something that we can put out there to educate people. Again, I want to do some education, not really education, just forewarning now. I feel like we have educated of like, look, here's 4 things we're seeing in our community. Here's the fines for these 4 things they sent us. So it's a great addition. I think I'll do that. And it's 0 tolerance at this point. We're going to cite you. So be prepared. That's my direction to the police force. Now keep in mind, you know, when we call and people get frustrated, you only have so many officers available within the Central Marin Police Authority. And so you can imagine, you know, when you have 30,000 calls a year, start to do the math, and we're asking them now to take an aggressive stance on these 4 areas. We're not always going to be able to get there in time, but if it's seen, I don't want warnings at this point. I want them to issue citations. And so that is my direction.
Thank you. I think that's very wise. The other one. Oh, then my last question, I promise, is the warning is that we're supposed to be 6 feet apart, but they've been showing recently on some of the newscasts that the aeration of these fine droplets go much further than 6 feet. So maybe we ought to start thinking about in terms of 9 feet so that we could be really far apart. But I mean, when people are talking at least 6 feet, maybe we ought to start thinking about going to the wider distance between people. What are your thoughts on that?
I think from an enforcement standpoint, you know, we have to follow what the guidelines are within the enforcement. But I think from an education and being smart, yeah, I think the farther the better, right? And so we'll talk to the team and we'll see if, you know, how creative we can get. But yeah, right, it's the farther the better. You know, wear a mask and be 6 feet plus apart, 9 feet. Yeah, absolutely.
Thank you. I'll be quiet now. Goodbye. Thank you.
Thanks, Lucinda.
Good comments. Very helpful.
And we actually don't have anybody else with their hands up right now. Oh, there. Okay, you just got to say it, and then there we go. Okay, so we'll start with Barbara.
I had to unmute, sorry. I just want to quickly say thank you for being the adults in the room with all this. I think it's incredible how disruptive and uncooperative some people are being. And, you know, I'm in a high risk category myself. There are days that I feel like I can't even leave my house because so many people don't wear masks. For instance, when they're walking on the paths and they come well within 6 feet of you, and they can't, even if they have a mask around their necks, they can't take the time to put it over their face when they pass within 2 feet of you. It's infuriating to me. And you guys are the adults in the room. And, you know, Todd, thank you for doing the enforcement. I mean, we got to do it. We all need to grow up and take this seriously. So thank you. I also want to thank the hero behind the scenes, Rebecca Vaughn, who keeps everything running in our wonderful little town. And I love seeing your face, Rebecca. So thank you. That's it. Thanks.
God bless you. Right on, Barbara. Yep, exactly.
Thank you, Barbara. All right, and we got James up next.
Hi.
Hello.
I had a question. I think this is probably for Ruben. You know, I've been complaining now for several weeks about the situation on Endeavor where there were electrical wires going through a eucalyptus tree up there. And the town has gone up there and done a lot of pruning and taking care of a lot of stuff, but they can't take care of the electrical wires. So last week, I finally decided to contact PG&E myself. And since I couldn't find any way to contact PG&E except through emergency line for something like that, which didn't seem to me an emergency, but nevertheless, I did that. And actually somebody came out and looked at it within an hour, and I went up there and met with him. He said that those electrical wires are low voltage wires, but they are uninsulated and they do go through the eucalyptus and fir tree there where branches can blow up against them. And he said he was going to call vegetation management and have them take a look at it and do something. So the next day I got a call from vegetation management at PG&E, who went up there and said they didn't need to do anything. The management company said that this didn't fall within PG&E guidelines, and that they weren't concerned about these low voltage wires, uninsulated wires going through the tree. Now, I don't know what low voltage means in this instance, because I forgot to ask him. I assume it's 220 or 110 or something, but it seems to me that uninsulated wires in trees don't belong next to each other. So that's my comment, and not a question really for Ruben if he would agree that what PG&E said, that's fine to leave it that way.
Yeah, so PG&E is regulated under their maintenance under the Public Utilities Commission. And so that basically tells them, depending on the voltage coming through the line, on how much clearance they need. Most PG&E is concerned with their primary and secondary lines, which are usually the top two on a utility line. The lower ones, when they say low voltage, are more your phone lines and your cable lines, which running through the trees don't cause a fire hazard per se. What they end up doing is will knock out your communication system. So that's what they mean by low voltage. Our bigger concern for us on the fire hazard side is whether high voltage lines are actually going through the trees that will eventually arc.
Well, actually, those are electrical lines. Those are not, when he was talking about low voltage, he said that those are the electrical lines. The distribution line, whatever it's called, which is a higher voltage, ends just before the eucalyptus tree, but these other wires, electrical wires, continue through the trees. And then from those lines feed a couple of the houses that are at the end of Endeavor there. So from what I understand from the PG&E person is that those are live electrical lines. We're not talking about the lower lines that are insulated. So that's where the vegetation management person said, well, that's not going to cause fire. So I don't know, but it doesn't seem to me.
Low voltage, usually low voltage lines are considered your communication lines. 220 will start a fire if sparks and arced. If you have a specific address, we'd be more than happy to go take a look at it and evaluate it. And then we can contact PG&E from our end, and that may be able to assist with that portion of it.
Well, Marla is aware of this and has been up there in the past cutting foliage and so forth. So I think the address is 134 Endeavor, across from 134, I believe is what it is.
Yeah, we'll go up there and take a look at it, James, and if make a determination. If we feel like it's a fire hazard, we'll definitely contact the vegetation management side. Sometimes if they get a call directly from the fire department, it may get a little more speedier response.
Okay, now, I just appreciate some feedback. I don't want to create problems where there are none, but
no, your concerns are valid. Like I said, we'll go determine it. If it's a hazard, we'll have it mitigated. If it's not, we'll let you know and we'll move forward.
Okay, that sounds good. Another comment, if I may. Yesterday, I had a water heater installed, and so the inspector came over to take a look at it and approved it easily with no problem. But what I was concerned about from the plumbing company was that they were given a window of 1 to 4 p.m. as when the inspection would take place. So that seems to me a very long window. And I said, well, maybe you can call that day and get a tighter window. He said, I don't think so, and so forth. So I was just working with a 1 to 4 p.m. window for an inspection that takes, 5 minutes, probably 10 minutes at the most. Is there not some way of pinning down those hours to a shorter time period? Because there was somebody from the plumbing company here that during that time, and of course I was waiting around, and it's not the end of my life sitting here, but it seems expensive. It seems like there should be some way of fine-tuning those hours, or certainly on the day of tracking where the inspectors are going, so you can give a little finer time.
Yeah, absolutely. I think Adam's on the call. Adam, you want to take that one?
Yeah, sure. And I think that's a great comment, something that I can definitely focus on and look at internally. I think the one thing to point out is we just have one inspector, building inspector, full time. Generally, what we do is we have in the morning, he will get his assignments for the inspections, both scheduled for the morning and the afternoon. The challenge with having one inspector is that we basically, he will go sequentially from one to the next. And some inspections can be very smooth and simple and easy, and others can take quite a while, and it's hard to really gauge exactly how long that particular inspection is going to take. And so that's why we have these windows. But nonetheless, there's potentially something we can look at as how to narrow that a little bit more. I don't think we're going to get down to something like an hour because, again, like I'm saying, unless we had additional inspectors that could schedule those things hour by hour, it's just a function of the sequential nature of the inspections that he is going to be assigned to do in any given day. Sometimes I will say even the morning inspections end up having to go into the afternoon because you're not able to accomplish all the morning inspections in one shot. But nonetheless, I think it's a really good comment and something I can look at and talk to our building inspector and building official, talk to them about and see if there's any better ways of doing things that might help you out in the concerns that you raised regarding having the plumbing contractor there for 3 hours in the afternoon.
UPS has some kind of tracking system, so you can actually, at some point along the line, track where the delivery truck is located in when it gets in your neighborhood or something or other. I'm wondering if there's not some way of having online or available a list of inspections and sort of somewhere where the inspector is in getting through that list, or some kind of tracking system like that that would make it a little easier to get a little fine tuning to this process.
Right.
It's a cool idea.
Yeah.
I don't know if it's within our means, but it's certainly, I think, at least worth figuring out if it's within our means. Anything else, James?
The only other comment since raised it was the business of masks. And yes, that continues to be a problem out there on like the bike path over here in Corte Madera and Madera del Presidio. A lot of people are wearing masks now, but there are enough people coming by who apparently don't know what 6 foot is. And as somebody said, there's nothing magic about 6 foot, except that that's essentially what the rule says. If you're getting closer than 6 foot, have a mask on, put it on before you get there. So I'm sympathetic to what Todd was saying about policing this, because it probably will create some uproar and throwback. But if there could be I don't know about signage, more signage, for example, along the trail, a couple of places, or something. I don't know what the answer is, but we certainly need everybody on board on this. And it's like the unleashed dogs. I can't believe still that that doesn't really bother me, but I was just walking down Madera del Presidio the other day on my usual walk, and there's a woman with 2 dogs out there running around and sniffing and carrying on. And I thought, I'm not going to say anything. And they were pleasant dogs, but why? I don't know. That's all I'm going to say. Thank you. Thanks very
Thank
much
you,
for
James.
having me, by the way.
Absolutely. Good points, good comments. Adam, thank you for explaining, kind of why we have the inspection window system that we have. That was really helpful. I personally did not understand that before, so thank you. And thanks, Ruben, for addressing James's concerns. Hopefully we can take a look at that and either initiate some mitigation if it's warranted, or at least, at the very least, put James's mind at ease if it doesn't seem to be an issue. Any other folks, members of the public on the line here, if you've got any questions for us or any, just thoughts you want to share, go ahead and put your hands up. It's only 11:30. Lucinda's hand's back up here, so we'll go to her.
Thank you. Rebecca, I'd like to give you a call. What's your telephone number direct?
It's 415-927-5085.
Okay. And this may be out of protocol, but I would like to address one of the items that's on the meeting tonight. And if I send an email to Rebecca, is that the proper way to do it? I might not be able to stay on the call long enough to address it, but I have brought it up previously in this environment, and it's regarding the tree, the dead tree that is off the fire road up in Alta Terrace area. I was just wondering if that's been looked at and any determination has been made. Ruben, do you have any thoughts on that?
Yeah, so Lucinda, I did take a look at the tree last week, and it is something that needs to come down, because I just got to look through our maps to see who the property owner is, whether it's the property owner on Sausalito or whether it belongs to the old Bill Graham Estates. So we'll have that taken care of.
Thank you. And then back on the agenda for tonight, I'd like to at least express my hope that we can get a notification from the fire department when they have deemed a tree to be an imminent danger to the community, and that it then would be removed. And that's part of what I wanted to send an email to Rebecca about. So
we also have a public comment at tcmmail.org. So when you call me later, I can explain that to you, but it's probably best if you copy that email as well, so we can make sure that it definitely gets seen and read out loud for tonight's meeting if you're not planning to attend in person.
thank you.
Alrighty, great. Okay, thanks, Lucinda. Let us know if you have anything else. Good. Okay. No other hands up right now. I don't know if any of our staff have any updates that they want to give, but we're seeing attendance at these weekly chats kind of dropping. So for most of this call, we've had barely more members of the public on the line than we have staff here. So I just want to give everyone a heads up that we are going to start looking at if there's maybe a better time, a more effective time to be doing these where we can reach more people. And that'll be we want to make sure that we're getting feedback from you guys on what time we're doing this so that we can make sure that we are actually reaching the most people. So just kind of letting you guys know, keep an eye out in the next, maybe week or a few weeks that we're going to start. I think we're going to probably do some surveys and public outreach to try and figure out if there's a more effective time to be doing these that's going to work for more people. But we've got Susie's hand up here, so we'll go to her. But then if we get to a point where nobody else has anything to say, we may just go ahead and end early. We'll get Susie on the line here. You there, Susie? Oh, she's muted.
Can you hear me?
Yes.
Okay, hi. I wasn't sure if I really was just checking in to be one of those people to support all you people who are being here at one time. Thank you. But so I don't know if it's all right for you to answer this question. It's sort of an opinion question, and I'm not sure. I would consider it to be not an official town opinion if you were able to answer it. Or if, but what do you think about really small gatherings outside? I'm talking about having drinks with a couple of neighbors, distance without fail, you know, the book club meeting in somebody's backyard outside, or things like that now. And I'm really asking you guys as friends, because I know most of you, I know you all. RJ, I know less, but but what do you, I mean, what do you think about that? Or do you think things are so bad that we maybe shouldn't be doing that right now? I mean, you know, here, as you know, I'm on my own here, and occasionally I'll have people sitting in my driveway, and I don't have many. You actually probably know all these people, but that doesn't make any difference. I know that doesn't make any difference. I don't know.
Yeah, I mean, I think what we would all tell you is that you know, we defer 100% to the actual experts on these matters, you know, the public health officials and the doctors and the epidemiologists, because at the end of the day, what this all comes down to is science. And I can't speak for our fantastic staff here, but I am certainly no scientist. So, you know, it's just, you know, it's what's the formula that they give you? It's like duration of exposure multiplied by like you know, like density of particles or something like that. So it's like you know, it's a kind of a probability game, right? And I think it's important that we all kind of, you know, take into account what our own risk level is, both in terms of, you know, our physical characteristics and also just how we feel. Because, you know, if you don't want to be stressed out if you feel like, you know, you may be getting yourself into situations where you don't feel safe. Nobody wants that. So, you know, I would say the number one thing is do follow all public health guidances. If you know, if you feel that you would feel more comfortable, you know, being even more stringent, absolutely do that. I would say, you know, I would not, I'm a young guy, I would not be less stringent. I just, you know, I don't think it's worth the risk.
I agree. Yeah. And you know me, I pay attention to this stuff, but.
And Susie,
Right.
I would just look at what is allowed. We're in phase 2. And so I would, on stuff like this, I then go, okay, well, outdoor dining is allowed, right? We're allowing outdoor dining. And so I use that as if I'm going to have, you know, I did a birthday parade for my son, you know, and so who did I invite? And my first conversation was, what is everyone's sphere of influence? Are you guys all just being at home? I mean, how impactful is that if I'm going to have someone in my area, right? So how big are people out and about doing this a lot? I'm probably not going to invite them. If it's a smaller sphere of influence for each person, okay, fine, I invite them, right? But then I'm going to follow the rules. And so if they're going to come through my house into the backyard, they're going to wear a mask. And then we're going to distance. And I think Lucinda said it, I don't do the 6-foot rule. I do a little bit more, you
Right.
know? And then you do that. And so, but you just use good judgment and you follow what's kind of already out there as a best practice, you know, and I look at outdoor dining as one of them. You know, you're much safer outside than you are indoors, but again, there's a risk. And so it's just a conversation, being smart and looking at, you know, kind of some things that we can look to for best practices.
Sure.
Yeah. Becca, did you want to jump in?
I
Well,
get
I did ask the county for some guidance to try and get some messaging together in advance of the 4th of July holiday weekend, knowing that people were going to want to try to get together in some way, shape, or form, because it wasn't clear, since their messaging coming out from the county was stay at home, that seemed to be contradicting their social bubble guidelines that they published prior. And even they said that the social bubble guidelines are not fail-safe. You have to adhere to the social practices, the social distancing practices, wearing masks, being distant in your backyard. And they're only as safe as the people that everyone in your bubble associates with. So you have to be comfortable with, you know, is your bubble also expanding outward? I have a child in camp. I know my child is coming into contact with 12 additional families' germs every day. So we take extra precautions. But you just have to take all of this advice in whole and feel what's best for you, but also be safe about it. Wear your masks, stay 6 feet or farther apart. And it's difficult.
Yeah, yeah. Well, I'm clear on that, and I agree with all you guys. I just thought there might be some little opinion in there that would be like, oh yeah, or whatever. So
Just trying to balance your need to
I know.
other human beings with also keeping yourself and your family safe.
Yeah, exactly, exactly. And you know what? I totally see why you guys have to reschedule this meeting or whatever. It's incredible to have all of you here, and you're seeing the same people out here all the time. And I wish the whole community would take advantage of this, because I know that everybody has questions all the time. They're constantly criticizing this department, that department. And I say, well, just go on Tuesday and pay attention. That's right, it's a great opportunity. But anyway, I get it, and thank you very much. And you know,
Thank you, Susie. Yeah. Thanks, Susie. Always great to hear from you. And I personally am hoping that the reason that attendance is dropping on these is because folks are being able to kind of get back to work somewhat. Whether that's true or not, I can't say. But anyways, okay. Thanks, Susie. Anything else from you?
That's it. Thank you.
Alrighty. Thanks a lot. We've got Patty, and then James has his hand back up here.
Hi, guys.
Hello.
So I totally understand what Susie's talking about with wanting to get together with little clusters of people that you know intimately. But the fact that you know them intimately doesn't mean that they're not a carrier. And I know that I read an article recently that said that the neighborhood gatherings in Sacramento was one of the main reasons for the surge. So I tried to get together with a friend for a happy hour, wearing a mask and sipping my wine through a straw underneath my mask, because I didn't want to take any chances. And we were sitting about 12 feet apart. But the problem with the family gatherings is that you get lax, especially if there's alcohol, and you take it off to take a sip of wine or to have a bite to eat, and then you forget to put it back on, and then a new person enters, and that hasn't happened. So I think one of the major takeaways I got from something Matt Willis said was, just because something is permitted doesn't mean it's safe. And everyone has to make that call for themselves. That, you can say, well, they're allowing us to have 10 people gather or something, but that doesn't mean, it's free and clear. It's just a risk that you have to assess. So that's my 2 cents. And everybody should wear a mask all the time.
Thank you, Patty. Thanks for sharing that. And this is coming from a nurse, everyone. So
that's right.
Alrighty. Thanks, Patty.
Thanks.
All right. We'll come back to James here. Hey, James.
Hi. I just wanted to follow up on the last 2 commenters, Susie, and say that I would encourage the town as much as possible to, in their communications, to emphasize the medical end, as you are doing on this, the medical experts and so forth. I read something, a headline this morning, I didn't look into it yet today, that the American Medical Association, the American Nurses Association, and another healthcare workers association, I think nationally, had come out with recommendations for everybody to wear masks and so forth. But I haven't looked at that yet today. But again, citing some sources like that may be helpful, and then making sure that, as I think Rebecca was talking, that everybody's in the county is on the same wavelength and not giving different messages about outdoor masking in particular. I think the message is now consistent, but somehow some people aren't getting it. So I'll push it on next door. And one other question, Todd, would it be, I don't want to do something prematurely here, would it be okay to say that the town is thinking about enforcing the mask requirement, or should I just wait until you actually do something.
No, and I think all of you, I mean, I think it's completely appropriate to put something out because it's the truth, and we're not thinking about it, we're going to do it. And so that's happening. And I think a lot of you have helped with some of the messaging, you know, as we put stuff out. So, you know, you guys are our messengers just as much as we are. And so when you hear something, consider it ready for prime time. And so you can put it in your own words, you know, that would be great and helpful. So please, anything you can do to help.
Right. We're in public right now. So nothing we're saying here to you guys is, you know, secret or anything like that. This is a public meeting. So.
Well, I understand, but I've said things in public that are secret too.
Join the club. Join the club.
By the way, if I can help in some way, feel free to give me a call or something. I'd be glad to help out with messaging or something.
Yeah.
Thank you
Thanks
so
a lot.
much for having these. And I understand you may have to cut back on them or do something different because maybe a better time or maybe fewer of them or something from your standpoint. They're fine with me every week, but there's a lot of people involved.
Right. Definitely want to be respectful of our staff and our department heads' times. Anyways, thanks a lot, James. Lucinda's got her hand back up here. We'll come back to Lucinda.
I want to follow up what James just said is we very much appreciate the time that you all have given to us to get our comments, and that maybe if we did it every 2 weeks or once a month, that might give the people an opportunity and focus more on participating. Maybe a quick little survey of people, because I know it takes you know, a whole hour out of, well, just there's 6 of you on the line, there's 6 hours out of the town. So I think that it is worth of finding how we can get more people to participate. And one quick question, Todd, were you able to talk with Chief Norton about having more meetings? Is his feeling to do that on some kind of a basis?
Yeah, so we continue to talk about that, and something will be coming forward shortly. It definitely probably wouldn't be on a weekly basis, but you know, a monthly basis every 6 weeks as needed. That was really successful, and I think he's also considering changing the platform where it's more like this. It's an interactive type of opportunity, so it's just not him receiving a question, reading it, and then answering it. It's more of a dialogue back and forth. And so yes, that's going to happen.
Thank you, and thank you one and all for all of the input that you're giving to us. We the public really appreciate it.
Absolutely. And we appreciate you guys, you know, taking advantage of the opportunities that we try and put out there. So thank you all. Phyllis has her hand up here, so we will go to Phyllis.
Did that work? Can you hear me?
There you are.
Hi, I want to echo part of what Lucinda was saying. I'm very appreciative of the time that you all are giving to us and having this kind of a meeting with all of you. And I don't think it's taking away from town business. I think this is part of being administrators of the town, to find a way to include us all in. So I'm very appreciative of that too. And I hate to say it, but I think, Todd, you're right. You're going to have to put in the fines for not wearing masks, because people really, things were opening up, and that's the first thing people, well, the second thing people wanted to do. First was see each other face to face, and the other was not to have a mask on. And open air out on the path. I'm on the path almost every day over by the DMV, the Sandra Marker Trail, I think it's called. And people have gotten more lax with wearing masks along there. And especially cyclists as they zoom by. And now when you hear how much can be carried in their airstream and how we already know they're teeny particles, but how really micro they are. That's irritating. you know, we can wear our mask and they're not, and they don't, it's like F you. So I think some people would understand a fine and have more respect for it, but it really could hit their pocketbook. Let's face it. Anyway, that's all for me for now. Thank you so much. I really appreciate it and look forward to however you structure it for the next time.
Thanks, Phyllis.
Thank you, Phyllis. Appreciate you.
Eli?
Yeah.
Actually, Skip is standing here next to me. Could he ask a question?
Yeah, absolutely.
Quickie. Our neighboring municipalities, Larkspur, Mill Valley, Kentfield, those guys, are most of the city governments on the same page with Corte Madera? I know there's always some variation, but generally, you guys on the same page with respect to COVID precautions, city operations?
Generally, yeah, and I think Todd can speak more to that.
Yeah. I mean, we ebb and flow, but we have enough of each age group that we all talk about it, and we're very similar. I'll tell you that one of the positive things that has happened from this at all levels of government, that we all talk, and for the managers, the city and town managers in the county, with the county administrator, we talk 2 to 3 times a week, and we have for the last 3 months. And so we talk about everything. And then we, you know, best practices, and then we assign individual cities and towns to help us with those best practices to make sure we're all moving forward consistently in our messaging and how we handle things and how we respond. And so, yes, absolutely. And then again, at all the department head levels, they also talk, you know, weekly. And so that is one of the best things that has happened from this. Because we're united, and so there's been so much consistency for everybody because we're all similar, as you said. So, yeah.
Good. Thank you.
And I'd like to follow up with the idea of having Mike Norton speak again and do more Q&As. I understand a weekly thing wouldn't be, you know, okay, but while we were in the height of people wanting to defund police departments and whatever. But, you know, the need doesn't go away to have, I was talking to a friend yesterday and she had no idea that Mike had even been on having a Q&A, and she was sorry she had missed it. So I think that would be important too, if you could get Mike in on these again also.
Okay. Yeah, absolutely. Thank you, Phyllis. And I just say that, you know, just because someone missed it, you know, it is linked on the websites. It's easy to get to. I think anyone that wants to join this conversation with CMPA and Chief Norton should really start on that public community meeting, as well as the police council meeting. Those are 2 really good meetings that give you a good foundation and education to start the conversation. Because as you know, every municipality is not created equal. Right. So it gives you a good starting point, you know, and so please, again, if any of your friends have any questions, you know, point them there. And again, I think in the next few weeks, you'll see some calendar invites to those community meetings. Absolutely.
So I'm sorry, go to the town website and then is there a link for community meetings? Is that what you're saying?
I think, Rebecca, jump in, but isn't it on the Central Marin Police Authority main page?
It is. You can go to the town's website. I think the police department's linked there, so you don't have to search for it, but you can just search for Central Marin Police.
Okay.
And it is on their homepage of the CMPA website.
Okay, great. Thank you so much. I'll send it.
Phyllis, if you can't find it, just message me on Facebook or something, and I can send you the link.
I think I can find CMPA, but thanks, Eli.
Or the actual video.
If I have trouble navigating their website.
Yes.
And their public information officer does publish all of those links on Nextdoor also.
It's actually, if you go to the main page, it is on there. There's the 2 links. It's a nice, thoughtful paragraph summary of what they are and what you're going to. So
perfect.
Oh, perfect. Thank you so much.
Awesome. Okay. Thank you, Phyllis. Thank you, Skip. Cool. All right. We don't have any other hands up right now, so I guess, oh, and we've only got a few minutes, so we'll wrap up. I'll just share real quick, since a lot of discussion about COVID happening right now. I learned something interesting reading the news today, which is that, you know, I think we've probably all gotten peppered with the occasional email from residents who, for whatever reason, feel that that, you know, economic concerns far outweigh public safety concerns, and, you know, urging us to open back up, even though it's not even in our power if we wanted to. But I was reading today that Sweden has long, so Sweden basically didn't really impose any sort of restrictions when COVID started. So they've been kind of just saying, you know, do whatever you want, you know, stay at home if you don't feel safe, but you can go out. And they didn't close schools, they didn't close restaurants, they didn't really close anything. And so it was kind of like almost like a real-time experiment in like, you know, what are the effects on the economy and what are the effects on people's health? And so what we saw immediately was that Sweden was having far higher mortality from COVID than any of the surrounding countries. But what we are learning as the economic data comes in is that they did not, through this, they did not avoid economic disaster. So Sweden has suffered economic damage over the last 3 months that is pretty much the same as Norway, Finland, Denmark, the surrounding countries. The only difference is they have a much higher death rate, which, you know, to me as a resident, that just tells me that, you know, I feel good about the path that our state and our county have taken with regards to, you know, being really careful about safeguarding public health, and kind of recognizing that this choice that some people offer about, you know, health versus the economy it's a false choice. And it turns out that even if we, you know, even in places where they have said, you know, forget it, let's just keep everything open because we can't afford to shut stuff down, the economy still tanks, but you just have a lot more deaths. So I just thought that was really interesting and wanted to share that with everyone on the line, just to let you guys know. With that, I think we're going to go ahead and wrap up here. So thank you so much to all of our staff for taking the time to be here today. Thank you for the members of the public who joined us and asked thoughtful questions, shared your thoughts. Like we said, we're probably going to start evaluating different time slots to do this, but we'll try and make sure that everybody's looped in on that. There'll probably be a survey of some point, so keep an eye out for that. And there's a council meeting tonight, so please join us tonight at 6:30 if you're able to for our town council meeting. All right, everybody, take care.